Very good morning to all. I am Dr. Smriti G. Solomon, Principal, Index Nursing College. Now today I am going to discuss regarding the substance abuse. Introduction. Disorders due to psychoactive substance use refers to conditions arising from the abuse of alcohol, psychoactive drugs and other chemicals such as volatile solvents. Now let us see the terminologies. Substance. Substance refers to any drug, medication or toxins that shares the potentials of abuse. Addiction. Addiction is a physiological and psychological dependence on alcohol or other drugs of abuse that affects the central nervous system in such a way that withdrawal symptoms are experienced when this substance is discontinued. Abuse. Abuse refers to the maladaptive pattern of substance use that impairs health in broad sense. Dependence. Dependence refers to the certain physiological and psychological phenomena induced by the repeated taking of a substance. Tolerance. Tolerance is a state in which, after repeated administration, a drug produced a decreased effect or increasing dose are required to produce the same effect. Withdrawal state. It is a group of signs and symptoms recurring when a drug is reduced in amount or withdrawn, which lasts for a limited time. Now let us see the Icd-10 Classification. F10 to F19, mental and behavioral disorders due to psychoactive substance use. Now F10 includes mental and behavioral disorder due to use of alcohol. F11 it includes mental and behavioral disorder due to use of opioids. F12 mental and behavioral disorders due to use of cannabinoids. F13 mental and behavioral disorders due to use of sedatives and hypnotics. F14 it includes mental and behavioral disorders due to use of cocaine, and F16 it includes mental and behavioral disorders due to use of hallucinations. Now, commonly used psychoactive substance. It includes alcohol, opioids, cocaine, cannabis, amphetamines, sedatives, hypnotics, inhalants, nicotine, and other stimulants like caffeine. Now, etiology. Etiology, it includes biological factors. Biological factors, that is the genetic factors, the family history of substance use disorders. Second is biochemical factors. Now in that, the role of dopamine and norepinephrine have been implicated in cocaine, ethanol, and opioid dependence. The next, abnormalities in alcohol dehydrogenase or in the neurotransmitter mechanisms are thought to play an important role in alcohol dependence. Neurological theories, it includes or it says that drug addict may have an inborn deficiency of in endomorphin. Next, enzymes produced by a given genes might influence hormone neurotransmitters contributing to the development of a personality that is more sensitive to the peer pressure, withdrawal and reinforcing effect of drugs, comorbid medical disorders, for example cancer, So to control the pain, the morphine drugs are given. Behavioral theory, drug use causes euphoric experience perceived as rewarding, thereby motivating users to keep taking the drug. Euphoric experience, it means the individual have the feeling of great happiness and excitement, and so they motivate each other to take the drug to have a euphoric experience. Then drug abuse as a result of conditioning or cumulative reinforcement from drug use. Then the stimuli and setting associated with drug use may themselves become reinforcing or may trigger drug craving that can lead to relapse. When the person wants to withdraw from the drug, but because of the environmental stimuli and setting, the person is having a craving to have the drug, and that triggers the taking of the drugs. Psychological factors. Now it includes general rebelliousness, means the person or the individual is having the person is not obeying the command given by the authorities, or generally the patient is refused to obey the authority. Okay, then sense of inferiority, the person is having feeling of inadequacy and insecurity. Low self-esteem, the person is having low self-confidence, hence not able to take the responsibilities. Then poor impulse control. The poor impulse control, the person, they are not able to control themselves and they engage themselves in certain behavior, for example stealing or robbery. Hence they have the antisocial activity, they indulge in antisocial activity. Then inability to cope up with the pressure of living and society, unable to handle the daily living activities and stresses. Then pleasure seeking, the person, they want to have the enjoyment. Okay, and so as they are having euphoric experience, so they want to have the euphoric experience, they take the drugs. Then desire to experiment and a sense of adventure, desire to escape from the reality. Then loneliness and unmet needs, that is poor stress management. And the person, when person remains lonely, not having any support and no one else to take the care of the individual, and the needs are not met, then there are more chances that the person will go for the relapse and even start taking the drugs. Then social factor, it includes religious reason and peer pressure. When the peer group are taking and the person don't want to take the alcohol, but still because the other peer members are taking, the person has to take. That is one of the reasons. Then extended pressure of education, unemployment, overcrowding, urbanization, all these causes the substance abuse. Then effect of television and mass media, different kinds of alcohols and the other drugs have been shown in the television. Okay, and the new generation or the young generation, They're very curious to have all these things, especially the alcohol. Then poor social support. When the person is in stress and not getting any support, he'll seek the help from the substance. Means he started taking substance and try to avoid the situation, try to avoid the environment and the reality. Then the occupation. Substance use is more common in chefs, barmen, executives, salesmen, actors, entertainers, army, personnel, journalists, and medical personals. Next is easy availability of the drug. That is, taking drug that can be obtained from illicit sources, street drugs. Taking drugs that can be brought legally without prescription, nicotines and opioids. Taking drugs prescribed by the doctor, for example, benzodiazepines. These all causes dependency. Then easy availability of drugs. Taking drugs psychiatric disorder, substance use disorders are more common, like depression, anxiety disorders, and that social phobia is very common. Personality disorders, especially antisocial personality. Then occasionally inorganic brain disorder and schizophrenia, the substance abuse can be seen. Consequences of substance abuse. These commonly lead to physical dependency and psychological dependence, or both. It may cause unhealthy lifestyle and behavior, such as poor diet. Chronic substance abuse impairs social and occupational functioning, creating personal, professional, financial, and legal problems. Drug seeking is commonly associated with illegal activities such as robbery or assault. Drug use beginning in early adolescence may lead to emotional and behavioral problems, including depression, family problem with relations, problems with or failure to complete school, and chronic substance abuse problem. It means when the adolescent individual started taking medicines, will be having problem like depression, problems in the family, and even not able to complete the school. In pregnant women, substance abuse jeopardize fetal well-being, danger of us. Okay, loss of pregnancy. Then psychoactive substance produce negative outcome in many patients, including maladaptive behavior, that is bad trips, drug-induced psychosis, and even long-term psychosis can occur. Then IV drug abuse may lead to life-threatening complications. Illicit street drugs pose added dangers. Materials used to dilute them can cause toxic or allergic reactions. Now next comes to the alcohol dependence syndrome. Now alcohol means essence. Anciently it is called as Magnus Haas, which is derived from Arabic word. Alcoholism refers to the use of alcoholic beverages to the point of causing damage to the individual, society, or both. Chronic dependence of alcohol characterized by excessive and compulsive drinking that produced disturbance in mental or cognitive level of functioning, which interferes with social and economic levels. Epidemiology. Incidence of alcohol dependency is 2% in India. 20 to 30% of subjects aged above 15 years are current users of alcohol, and nearly 10% of them are regular or excessive users. 15 to 30% of patients are developing alcohol-related problem and seeking admissions in psychiatric hospitals. Process and stages of alcoholism. Process of alcoholism. First stage, experimental. The individual thing. Now let us do the experimental, how it act. Recreational, euphoric effect. It gives the euphoric effect, so it's a recreational for the enjoyment. And then relaxation stage. Now the person is exhausted working, now want to get relaxed, so takes the alcohol. Then compulsion stage. Now the person is addicted. Without taking alcohol, the person is not able to work, or the patient may be having physical dependency or the psychological dependency. The person is now completely addicted to alcoholism. Without taking alcoholism, the individual cannot do anything. Stages of alcoholism. First is the progressive stage, crucial stage, when the person wants to live but unable to live. Now the chronic phase. Now the person is completely addicted and chronic intaker, become a chronic drinker. Then rehabilitative phase. Then that is the person when really realized that it's very harmful for the individual, then he wants to get rid of the alcoholism, and so he takes or seeks the rehabilitative services. And after rehabilitation, there is road for recovery. That is, the person are supported by the other family members, by the other society members, so that the person will not go for the relapse and will become sober. So these are the stages. Now, clinical features of alcohol dependence. Minor complaints includes malaise, dyspepsia, mood swings or depression, increased incidence of infection. Then unusually high tolerance for sedatives and opioids. Then untreated injuries, for example, cigarette burns, fractures, bruises that cannot be fully explained. It means when we ask to the individual how you get cigarette burn, the individual is not going to explain that, not able to give us the explanation how he gets cigarette burn. Then poor personal hygiene, the individual is not able to maintain the personal hygiene. Nutritional deficiency, especially the vitamins and the minerals. Tendency to blame others. They blame others. Okay, denial of the problem. If they are having any problem, we ask, you are having any problem? Always say, no, I am okay, I'm not having any problem. Then consumption of alcohol containing products. Sometimes when they didn't get the alcohol, the individual start taking the alcohol containing products like mouthwash, aftershave, lotions, hair spray, lighter fluids, body spray and shampoos. Secretive behavior may attempt to hide disorder or alcohol supply. They will ask from where you are getting this alcohol. They will not give us the answer. Keep the secret from where the individual is getting the alcohol. Then rationals, problems displacing anger, guilt and inadequacy to confront the illness. Now let us see the Icd-10 criteria for alcohol dependence. Okay, a strong desire to take the substance, means the person will be having a strong desire to consume the substance. Okay, difficulty in controlling substance taking behavior, notable to control substance taking behavior, poor impulse control we can say. A physiological withdrawal state, progressive neglect of alternative pleasures or interest. Okay, in the activities in which he is getting previously the pleasures and the interest, now he neglect all the alternative pleasures, activity and interest activity. Persisting with substance use despite clear evidence of harmful consequences. The individual knows all the harmful consequences but is still continue to take the substance. Now let us see the psychiatric disorders due to alcohol dependence. It includes acute intoxication, withdrawal syndrome, alcohol-induced amnestic disorder, and alcohol-induced psychiatric disorders. Now let us see one by one. Acute intoxication. What is acute intoxication? It develops during or shortly after alcohol ingestion, characterized by clinically significant maladaptive behavior or psychological changes like inappropriate sexual or aggressive behavior, mood swings, impaired judgment, slurred speech, not able to speak properly, incoordination, unsteady gait, unable to walk properly, nystagmus. Then impaired attention and memory. Forgetfulness can be seen, and impaired attention, not able to give proper attention to the work or to the situation or to the environment. Finally, resulting in stupor or coma stage. Second is withdrawal syndrome. Now what is withdrawal syndrome? Person who have been drinking heavily over a prolonged period of time and rapid decrease in the amount of alcohol in the body is likely to produce withdrawal symptoms. Means when the patient is taking heavily more amount of alcohol but now stop taking alcohol or the amount is decreased, then the patient shows withdrawal symptoms. It includes simple withdrawal syndrome. Now what is simple withdrawal syndrome? It is characterized by mild tremors, nausea, vomiting, weakness, irritability and insomnia and anxiety. Means the patient will be having tremors, nausea, vomiting, okay, and weakness, irritability, insomnia and anxiety. Next is delirium tremens. It occurs usually within 2 to 4 days of complete or significant abstinence from heavy drinking. The course is very short, with recovery occurring within 3 to 7 days. It is characterized by a dramatic and rapid change of disordered mental activity with clouding of consciousness and disorientation in time and place. Means the patient will be having clouding of consciousness and will remain disorientated with time and place, not able to identify the time, morning, evening and night and the place even. Then poor attention span, vivid hallucinations, usually of visual hallucinations are very common, but tactile hallucinations can also occur. severe psychomotor agitation, then shouting and evident fear, grossly tremulously, hand tremors, hands which sometimes pick up imaginary objects. Then it means the things are not there, but still the patient will be having some imaginary objects and hands try to pick up the imaginary object. Autonomic disturbances such as sweating, fever, tachycardia, raised blood pressure and pupillary dilatation. Dehydration with electrolyte imbalance can be seen. Reverse of sleep-awake pattern or insomnia means the patient is not able to sleep during the night time but sleeps during the daytime. Blood test to reveal leukocytosis and liver function test. Lastly, the death may occur due to cardiovascular collapse, infection, hyperthermia, or self-inflicted injury. Third is alcohol-induced amnestic disorder. Now, chronic alcohol abuse associated with thiamine deficiency is the common and frequent cause of amnestic disorder. Now, it includes Wernicke syndrome and Korsakoff syndrome. Wernicke syndromes characterized by prominent cerebral ataxia, palsy of the sixth cranial nerve, and peripheral neuropathy and mental confusion. Korsakoff syndrome, prominent symptom is gross memory disturbance, and other symptoms include disorientation, confusion, confabulation, poor attention span, and distractibility, impairment of insight. The insight is also gets impaired. Now next, fourth is alcohol-induced psychiatric disorders. It includes alcohol-induced dementia. It is a long-term complication of alcohol abuse characterized by global decreased in cognitive functioning, decreased intellectual functioning and memory. This disorder tends to improve with abstinence, but most of the patient may have permanent disabilities. Alcohol-induced mood disorder, persistent depression and anxiety. Suicidal behavior due to continued drinking, major depression and serious medical illness. Alcohol-induced anxiety disorders characterized by panic attacks during acute withdrawal of 4 to 6 weeks of abstinence. Impaired psychosexual dysfunction, erectile dysfunction and delayed ejaculation are common in chronic alcoholics. Pathological jealousy, that is, the patient is having delusions that the partner is unfaithful and having some extramarital relationship with someone else. Alcoholic hallucinosis, presence of auditory hallucinations during abstinence following regular intake. Alcoholic seizures or rum fits, generalized tonic-clonic seizures occurs within 12 to 48 hours after a heavy bout of drinking. Sometimes status epilepticus may precipitate. Complications of alcohol abuse. Alcohol damages body tissues by irritating them directly through changes that occurs during alcohol metabolism, by interacting with other drugs, by aggravating existence disease, or through accidents due to intoxications. Tissue damage can lead to a host of complications of cardiopulmonary, GI complication, hepatic, neurological and psychiatric complications. Diagnostic evaluation. It is done through history taking and by conducting mental status examination, physical examination, and neurological examination. Blood alcohol level to indicate intoxication. Urine toxicology to reveal use of other drugs. Serum electrolyte analysis revealing electrolyte abnormalities. Liver function test to rule out liver damage. Electrocardiography demonstrating cardiac problems. And then diagnostic evaluation is also done based on Icd-10 criteria. Treatment modalities. Symptomatic treatment may include respiratory support, fluid replacement therapy, IV glucose to prevent hypoglycemia, correction of hypothermia or acidosis, and emergency measures for trauma, infection, or GI bleeding. Treatment for withdrawal symptom. Detoxification. The drug of choice are benzodiazepine. For vitamin B deficiency, IV thiamine 100 mg twice daily for 3 to 5 days, followed by oral administration for at least 6 months. Anticonvulsant drugs are also given to control seizures. Maintaining fluid and electrolyte balance and strict monitoring of vitals and level of consciousness is also important. Close observation is essential, especially during first 5 days. Alcohol deterrent therapy. Deterrent agents are given to desensitize the individual to the effect of alcohol and abstinence. The most commonly used drug is disulfiram or antabuse. Disulfiram, it is used to ensure abstinence in the treatment of alcohol dependence. Its main effect is to produce a rapid and violently unpleasant reaction in a person who ingests even a small amount of alcohol while taking disulfiram. Doses. Initial dose is 500 mg per day orally for the first 2 weeks, followed by a maintenance dose of 250 mg per day. The dose should not exceed 500 mg per day. Action. It is an aldehyde dehydrogenase inhibitor that interferes with the metabolism of alcohol and produces a marked increase in blood acetaldehyde level. Accumulation of acetaldehyde more than 10 times, which occurs in the normal metabolism of alcohol, produces a wide range of unpleasant reactions called disulfiram ethanol reaction. It is characterized by nausea, throbbing head, hypotension, sweating, thirst, chest pain, tachycardia, vertigo, blurred vision, associated with severe anxiety. Indications. Disulfiram use is as aversive conditioning treatment for alcohol dependence. Contraindication. Pulmonary and cardiovascular disease. Disulfiram should be used with caution in patients with nephritis, brain damage, hypothyroidism, diabetes, hepatic disease, seizures, polydrug dependence, or an abnormal EEG. Patients at high risk for alcohol ingestion. Adverse effect. Without alcohol consumption, adverse effect includes fatigue, dermatitis, impotence, optic neuritis, mental changes, acute polyneuritis, hepatic damage. And with alcohol consumption, the intensity of disulfiram alcohol reaction varies, marked by convulsions, respiratory depression, cardiovascular collapse, myocardial infarction, and death. Nursing responsibility. An informed consent should be taken before starting treatment. Ensure that at least 12 hours have elapsed since the last ingestion of alcohol before administering the drug. Patient should be warned against ingestion of any alcohol-containing preparations such as cough syrups, sauce, and aftershaves lotions, etc. Caution patient against taking CNS depressants and over-the-counter medicines during disulfiram therapy. Instruct the patient to avoid driving or other activities that requires alertness. Patient should be warned that the disulfiram alcohol reaction may continue for as long as 1 to 2 weeks after the last dose of disulfiram. Patient should carry identification card describing disulfiram alcohol reaction and listing the names and phone number of the physicians to be called. Emphasize the importance of follow-up visits to the physicians to monitor progress in long-term therapy. Psychological therapies. It includes motivational interview, group therapy, aversive conditioning, cognitive therapy, relapse prevention technique. This technique helps the patient to identify high-risk relapse factors, cue exposure technique, assertive training, behavior counseling, supportive psychotherapy, and individual psychotherapy. Agencies concerned with alcohol-related problems. Alcoholics Anonymous. This is a self-help organization founded in USA by two alcoholic men, Dr. Bob Smith and Dr. Bill Wilson, on 10th June 1985. Alcoholic Anonymous considers alcoholism as a physical, mental, and spiritual disease, a progressive one which can be arrested but not cured. Members attend group meetings usually twice a week or a long-term basis. Each member is assigned a support person from whom he may seek help when the temptation to drink occurs. In crisis, he can obtain immediate help by telephone. Once sobriety is achieved, he is expected to help others. The organization works on the firm belief that abstinence must be complete. The only requirement for membership is a desire to stop drinking. There is no authority, but only a fellowship of imperfect alcoholics whose strength is formed out of weakness. Their primary purpose is to help each other stay sober and help each other alcoholic to achieve sobriety. Al-Anon. This is group started by Mrs. Annie, wife of Dr. Bob, to support the spouses of alcoholics. Al-Teen. It provides support to their teenage children. Hostels. These are intended mainly for those rendered homeless due to alcohol-related problems. They provide rehabilitation and counseling. Usually, abstinence is a condition of residence. Now next, we'll see opioid use disorder. The most important dependence producing derivatives are morphine and heroin. The commonly abused opioids in our country are heroin and synthetic preparations like pethidine and fodvine. More opioids users had begun with chasing heroin. They gradually shifted to needle use. Injecting drug users have become a high-risk group for HIV infection. Acute intoxication, it is characterized by apathy, bradycardia, hypotension, respiratory depression, subnormal temperature, pinpoint pupils. In later stage, delayed reflexes, thready pulse, and coma. Withdrawal syndrome, it rarely produces a life-threatening situation. Common symptoms includes watery eyes, running nose, yawning, loss of appetite, irritability, tremors, anxiety, sweating, cramps, nausea, diarrhea, insomnia, raised body temperature, and piloerections. Withdrawal symptoms begin within 12 hours of the last dose, peak in 24 to 36 hours, disappears in 5 to 6 days. Complications: illicit drug use, Parkinsonism, peripheral neuropathy, transverse myelitis. Intravenous use causes complications, skin infections, thrombophlebitis, pulmonary embolism, endocarditis, septicemia, AIDS, viral hepatitis, and tetanus. Individual also involves in criminal activities. Treatment: opioid overdose, treated with narcotic antagonist. Detoxification: withdrawal symptoms can be managed by methadone and maintenance therapy. After the detoxification phase, the patient is maintained on one of the following regimens: methadone maintenance, opioid antagonist, psychological methods like individual psychotherapy, behavior therapy, group therapy, and family therapy. Cannabis Use Disorder it is derived from hemp plant Cannabis sativa. The dried leaves and flowering tops are often referred to as ganja or marijuana. The resins of the plant is referred as hashish. Bhang is a drink mode from cannabis. Cannabis is either smoked or taken in liquid form. Acute intoxication, mild intoxication, it is characterized by mild impairment of consciousness and orientation, tachycardia, a sense of floating in the air, euphoria, dream-like states, tremors, photophobia, tremors, lacrimation, increased appetite, and alteration in psychomotor activity. Severe intoxication, it causes peripheral disturbance like depersonalization, derealization, illusions, hallucinations, and somatic passivity. Withdrawal symptoms: increased salivation, hyperthermia, insomnia, increased appetite, loss of weight. Complications characterized by memory impairment, amotivational syndrome, transient or short-lasting psychiatric disorders such as acute anxiety, paranoid psychosis, hysteria fugue-like states, hypomania, and schizophrenia. Treatments are supportive and symptomatic treatments given. Next is cocaine use disorder. Cocaine is an alkaloid derived from shrub Erythoxylon coca. Common street name is crack. In 1880, it is used as a local anesthesia. It can be administered orally, intranasally by smoking or parenterally. Acute intoxication characterized by pupillary dilatation, tachycardia, hypertension, sweating and nausea, and hypomanic pictures. Withdrawal symptoms, it includes characterized by agitation, depression, anorexia, fatigue, and sleepiness. Complications: acute anxiety reaction, uncontrolled complications, compulsive behavior, seizures, respiratory depression, and cardiac arrhythmias. Treatment, management of intoxication, amyl nitrate is an antidote. Diazepam is given for withdrawal syndrome, antidepressants, and psychotherapy. Now, amphetamine used disorder, powerful CNS stimulants with peripheral sympathomimetics effect. Commonly used are pamolin and methylphenidate. Acute intoxication, it is characterized by tachycardia, hypertension, cardiac failure, seizure, hyperpyrexia, pupillary dilatation, panic, insomnia, restlessness, irritability, paranoid, hallucinatory syndrome, and amphetamine-induced psychosis. Withdrawal syndrome, it is characterized by depression, apathy, fatigue, hypersomnia or insomnia, agitation, and hyperphagia. Complications, seizures, delirium, arrhythmias, aggressive behavior, and coma. Next is Lsd Use Disorder, a powerful hallucinogens, first synthesized in 1938. It produces its effects by acting on serotonin level in the brain. A common pattern of Lsd used in trips, followed by long period of abstinence. Intoxications characterized by perceptual changes occurring in clear consciousness. Depersonalization, derealization, illusions, synesthesia, that is, colors are heard and sounds are felt. Automatic hyperactivity, marked anxiety, judgment impaired, and paranoid ideation. Withdrawal symptoms, flashbacks, complications, anxiety, depression, psychosis, and visual hallucinations. Treatment, symptomatic treatments are given: anti-anxiety, antidepressants, or antipsychotic medications. Barbiturates use disorders. The commonly abused barbiturates are secobarbital, pentobarbital, amobarbital. Intoxications, acute intoxications characterized labile mood, disinhibited behavior, slurred speech, incoordination, attention and memory impairment. Complications, intravenous use can lead to skin abscess, cellulitis, infection, embolism, and hypersensitivity reaction. Withdrawal syndrome, restlessness, tremors, seizures in severe cases resembling delirium tremens. Treatment, if the patient is conscious, induction of vomiting and use of activated charcoal can reduce the absorption. Treatment is symptomatic. Inhalant or volatile use disorder. The commonly used volatile solvent includes petrol, aerosols, thinners, varnish removers, and industrial solvents. Intoxications. Inhalation of volatile solvent leads to euphoria, excitement, belligerence, slurred speech, apathy, impaired judgment, neurological signs. Withdrawal symptoms, anxiety, depressions. Complications characterized by irreversible damage to the liver and kidney, peripheral neuropathy, perceptual disturbances, and brain damage. Treatment, reassurance and diazepam for intoxications are given. So till now we have seen introduction, terminology, Icd-10 classification, and etiology of substance abuse. Then we have learned about consequences of substance abuse, alcohol dependence syndrome, opioid use disorder, cannabis use disorder, cocaine use disorder, amphetamine use disorder, Lsd use disorder, barbiturates use disorders, inhalant or volatile use disorders.